They do say it depends on how nice your ultrasound machine is, because the newer ultrasound machines, which is what we have very nice ultrasound machines, can probably see the follicles better than the older ultrasound machines. So they say if you've got the older machines, you can still use the older criteria, but if you've got the newer machines, usually you're talking about 20 or more. But I will say it's a little hard for me knowing that history when sometimes I'll see a patient and I count and I get like 18 follicles, right? And they're in between that 12 and the 20. And I'm like, okay, but if you saw me 5 years ago, you would have met criteria. And now we're saying you don't meet criteria, but again, it's kind of like, well, you've got to look at the overall history. Maybe the other thing is we know the follicle count can change from month to month too, right? So I do think sometimes in those cases, I'm like, well, it's a little borderline. Let's just kind of keep this in the back of our mind as we're going through the process.
Yeah. I think age is so important here too.
That's
and just,
true.
I think experience of your physician. Again, yes, we like to use specific criteria to help diagnose our patients, but I certainly use 12 quite often because I will say the patient population that often we're looking at are older women, because by the time women are ready to have a baby, like our average patient a lot of times are 33 to 42, You're scanning a 39-year-old and they have more than 12 follicles.